We started off really focusing on canonicalizing our medical claims and pharmacy claims data into a standard format that can be used across many parts of the company, whether it's reporting or the back end for our provider dashboard or the back end for our member mobile applications. The goal was to canonicalize all the different claims schemas from our different customers and payers into a central schema that can be used for many downstream systems across the business. In that goal, DBT's it's done a lot of things, helped us do a lot of things. In addition to creating the canonical tables itself, I think what it's really helped do is make the broader organization much more data-driven. We've been able to get many cross-functional teams that were using data, but teams like clinical research or health economists or finance analysts, operations managers, we're all users of data, but now we're able to get them building in DBT itself. And so it's really made the entire company much more data-driven, where they're essentially becoming analytics engineers to a degree, which has made all these different functions much more data-driven. So I think that's one of the biggest value adds from DBT. It just makes it easier to get people that are maybe adjacent to the data engineering and analytics teams to kind of get into the DBT party as well and build directly into our core stack. For DBT Cloud, I think it enabled adoption to go faster up front because it kind of gave a prettier package all in one place that enabled more folks to kind of just get into the developer flows faster compared to kind of the open sourced versions. That said, now that I think we're kind of so far into DBT, we're actually exploring our data pipelines within a broader production ecosystem, which we're finding ways that would kind of go even faster with having a few more of the capabilities with the open source version as well. One of the more advanced use cases that we're particularly proud of is we've built what we call the outcomes optimization engine for delivering care pathways for our members, which essentially recommends specific interventions depending on kind of the highest chance that a member is going to hit their outcomes. And this is pretty much all built upon the data variables built in DBT, which capture things like a member's weight or their A1C or how much they're exercising or what they're eating. And then based off of those kind of inputs, we're able to use all of those attributes to give the best recommendation, to give the members the best chance that they could, improve their health, whether they're working on diabetes or obesity or depression or anxiety and things like that. And so all of that information, which is kind of just metrics built off of metrics, has really been the base for doing more stratified care delivery. Yeah, I remember when I first joined, so I lead the data science, data analytics, and data engineering teams. We had some folks that are like, hey, want to use DBT? And honestly, I was somewhat agnostic to DBT. I'm like, if people use it, cool. We had other kind of data platform tools, and I've heard about DBT, but I didn't necessarily have like a strong preference. I knew it was valuable and doing some pretty innovative things, but I think the best part was it didn't take a ton of like buy-in building to get people using it across the organization. Of course, it took work and time, but I didn't have to do a whole lot of management of getting it to really get implemented well across the company. So just kind of, I guess, boils down to like ease of use, because it really solves a lot of the challenges that the teams were facing organically. When I think about like healthcare technology, it is really like data technology. There's just so much data because it's capturing what a member's health is, whether it's through device biometrics or whether it's through user inputted kind of surveys. And there's just so much information. It really requires pretty robust data platform. So like, I actually don't know how healthcare companies can even operate without like super robust data platform technologies. Yeah, that's one of the kind of the exciting parts, is just healthcare and I guess other related industries just, I think, are going to really benefit from more adoption from tools like DBT kind of in the modern data stack. So I think Vida Health is just like one example of that, but I think there's whole industries that just need more of this because there's just so much information that can add value faster if it was just better organized, better centralized, and made more available for more downstream applications that are connected directly into user and member experiences, like delivering outcomes.